Hello, my name is Dennis Stokely. I'm an independent insurance broker here in Wilmington. I have been specializing in Medicare insurance, health insurance, regular insurance for the past 34 years here in Wilmington. I'm a Wilmington native, born downtown at the James Walker Hospital. I graduated from Hoggard High School in 1973, and then went on to graduate from the University of North Carolina at Chapel Hill in 1977. My agency is the Dennis G. Stokely Insurance Agency on 5129 Oleander Drive. I'm right next to the Wilmington Gastroenterology Doctor's Office, the old bowling alley of Wilmington. And I will be happy to present to you this Medicare 101 presentation. So let's understand the ABCs and Ds of Medicare. Let's understand some of the choices that you have coming up that you're starting to face. As I tell a lot of people, welcome to Medicare. It's a whole new ball game because there's a lot of different rules and regulations that you have not been familiar with. So let's go over first with Medicare. Who exactly is eligible for Medicare? A brief history of Medicare was signed into law by President Johnson back in 1965. Which time we had about 19 million enrollees into the plan. Today, we have over 58 million enrollees into the plan and growing drastically. In 1972, the coverage was provided for the under the age of 65 for the disability individuals. Then in the 1980s, supplemental insurance was introduced and they became all standardized. So your plans A, B, C, and D, and F were all the same between the insurance companies. 1997, your Medicare Part C was introduced, which are your Medicare Advantage plans. Then in 2003, it was introduced as Medicare Part D for prescription drug coverage, because up until that point, prescription drugs were not very expensive and they were not covered by Medicare. Then in 2010, the Affordable Care Act, the ACA Act, introduced no-cost preventative services along with reducing the Part D donut hole cost as it stands today. And of course, we'll probably have some more changes upcoming. So Medicare is a federal health insurance plan eligible for US citizens and legal residents. It's funded in part by the taxes you pay while you're working, and it's considered, of course, individual health insurance for those people that are on Medicare. So Medicare is eligible for those people, US citizens, that are age 65 or older. And it's also available for those individuals that are under the age of 65. If you have a qualifying disability that lasts for at least 2 years, you will be enrolled into Medicare on the 25th month of that disability and have the same benefits as those people that are age 65 and above. And of course, any person that has a diagnosed with end-stage renal disease or ALS are eligible for Medicare as well. So your coverage options, you've got Part A, Part B, Part C, Part D, and of course, you've got Medicare supplement plans. So let's take a look to see how all of these work together. Here's a copy of your old Medicare card that your parents may have had. That card had your Social Security number with an A or B after the number. The government decided it was not a good idea to have this Social Security card in your wallet or purse. So a couple of years ago, they reissued the Medicare cards, and now it's a mixture of letters and numbers. And it has replaced all of the old Medicare cards. So everybody received a new Medicare number. You'll also notice that Medicare Part A and Part B start the first of the month of which you turn 65 or are eligible for Medicare. Now, if you were born on the first of the month, then your coverage will start back the prior month. So if you were born June 1st, it would go back to May the 1st. However, if you were born on July the 25th, then your coverage will start on the 1st of July, the first of the month. So you'll actually get Medicare coverage before you actually turn the age of 65. Part A is your hospital insurance coverage. That's your inpatient hospital care, mental health coverage inpatient. Your skilled nursing facilities are covered under Part A, hospice care, and some blood transfusions are covered under Part A as well. For your Part B, that is for your physician services. It also covers some of your outpatient hospital services when you're not admitted to the hospital. Ambulance, outpatient mental health are covered under Part B. Lab services. We also have the durable medical equipment, your wheelchairs, oxygen, and walkers, so things like that are covered under your Part B coverage. We do have some preventative care covered under Part B, as well as outpatient physical, speech, language therapy, occupational therapy as well. So let's look at what's not covered by Parts A and B. Both Part A and Part B of Medicare have deductibles, they have co-insurance, and they have premiums. Medicare Part B has excess charges where the physician may charge 15% above the Medicare rate in which you are responsible in full. Medicare does not provide Medicare prescription drug coverage. Additional benefits such as hearing, vision, and dental are not covered by Medicare. And of course, long-term care or custodial care is not covered by Medicare. You're covered in the nursing home for the first 100 days if you are medically improving from an accident or illness, but after that 100 days are up, you may have to go to self-pay or rely on your long-term care insurance to provide coverage and help to pay for your nursing home stay. So let's take a look at your Part A coverage, your hospital costs. Most people have a zero premium for your Part A. That is because you've been paying your Medicare taxes, have been deducted from your paycheck each paycheck. So you pay as you go on that. It has a $1,556 deductible, which is a per cause deductible, which means if you break your leg 1 month, you'll pay that deductible. And if you break your arm 60 days later or 2 months later, then you'll pay that deductible again. Now, this deductible is $1,556. That's the 2022 amount. It may change, of course, for 2023, but that has not been announced at the time of this recording. The other cost is $389 per day when you're outside day 61 in a nursing home. And of course, the Part A coverage does not have any out-of-pocket limit. So the sky's limit during the calendar year for your total exposure based on the cost of your medical care. Your Part B coverage, of course, has a $170.10 a month premium, monthly premium for most people. That amount went up drastically from last year, 2021. And it may stay around that amount for 2023. It has not been announced at this point. It does have a $233 annual deductible. So that's just a one-time deductible. When you first see your doctor, you'll pay that deductible. It's an 80-20 coverage after that. So you would pay 20% of the approved charges for Medicare, and the Medicare would pay the 80%. It does also have no out-of-pocket limits as well for Parts A and Parts B. And also remember that on your premium cost, that $170 per month, it may be higher based on your annual income. So it could go up as high as $500 a month if you have income in excess of $500,000 per year. And they will look back 2 years to see what your income was 2 years ago to determine if you will have an additional adjustment applied to your monthly premium. So your choices are here. You can enroll in Original Medicare, which gives you Parts A and Parts B, and that's provided by the federal government. Now you have two options, Option 1 and Option 2. Option 1 would be going with a Medicare supplement insurance plan that's offered by a private insurance company, and it will pretty much cover all of your medical expenses between Medicare and your insurance plan. So Medicare is primary, they'll pay their bill. Then they will send the bill to your insurance company where you have your Medicare supplement plan, and they will pay the balance except for that $233 annual Part B deductible. You would also need to add a Part D prescription drug plan to that plan. There might be over 20 different plans in the state of North Carolina that are Part D, and this is based on the drugs that you're taking. So you do need to review your drugs each year with your insurance professional to determine if the current plan that you're on now will be good for the upcoming year, because you can only change these plans once per year as far as the Part D. Your option 2 will be a Medicare Advantage plan. It will combine your A, your B, and your D coverage together in one policy. It is also offered by private insurance companies, and it also provides additional coverages like dental, vision, hearing, and over-the-counter coverage that's not provided by the Medicare primary coverage that we just mentioned a few seconds ago. So let's take a look a little bit at your Part D formularies. All the insurance companies will have a formulary based on the different drugs, and that would be the price that you would pay as a copay based on if it's a tier 1 generic or if it's a tier 5 brand name drug, which would be a more expensive drug, that you would have a higher copay. And we'll get into that example in just a minute, and we'll explain that to you in a little further detail. But let's go over some fast facts here for your Part D coverage. The coverage, prescription drug coverage, will vary from plan to plan. You do have a catastrophic coverage, so there is not a cap to it, but when you get into catastrophic coverage, your prescriptions will be $3 or $5 per copay per 30 days. The enrollment occurs when you take a look at the insurance company's list of drugs and how they are covered, but you do need to kind of take a good look and do a comparison of all the different plans in North Carolina to pick out the best plan. Coverage is not automatic, and penalties will apply if you apply for your Part D coverage when it's not first available. That is a 1% per month penalty for every month that you go without the coverage. So if you waited 5 years and then decided to obtain a Part D coverage, you can get the coverage, but you will pay a little bit of a surcharge as a penalty, plus the cost of the monthly premium based on the insurance plan that you select. So let's take a look at your Part D coverage and exactly how it works. All plans will have a deductible stage, but some plans will have a 0 deductible. The 2023 deductible amount I just obtained is $505 for the deductible. Last year is $480, and some plans do not even have a deductible. Your next stage will be the initial coverage stage, where you will pay copays based on each tier of the prescription. Once you and the insurance company spend $4,430 in payments for the cost of the prescriptions, you will leave the initial coverage stage and go into the coverage gap, where you will pay 25% of the cost of the prescription. Then as soon as you spend out of your pocket $7,050, which will be updated for 2023, then you'll go into the catastrophic coverage, of which you would pay 5% of the cost, or a $3.70 or $2.90 copay for that prescription. And once again, those amounts will probably go up a little bit each year as each year goes by. Here's a quick example with Eliquis. It has a retail cost of $462 at a local pharmacy. So your first month you go in the month of January, you would probably pay that full price of $462 as your deductible. Then the next couple of months, you'll pay a $25 copay for that prescription. And then based on the other prescriptions that you may be taking, you may then go into the donut hole, where you'd have to pay 25%, which is the coverage gap. And your premium, your cost would then go up to $115 a month. And then once you have spent that over that $7,000 amount in a calendar year, then your premium will go down to $23.12 until the end of the year. And then January the 1st of the following year, everything will start all over. So let's cover a little bit about the Medicare Advantage plans. They will cover parts A, B, and drug coverage as well, all together in one policy. They are offered by private insurance companies. You cannot obtain a Medicare Advantage plan directly from Medicare or the government. And each plan will have different routine coverages for vision care, hearing care, wellness services, nurse phone line support, and dental coverage is very popular with these plans that's included. You must be eligible for Part C and enrolled in Parts A and B, and you must live in the planned service area, which would be New Hanover County, Pender County, Brunswick County. So you may have relatives that live in another state, another state or another county of North Carolina, that they have a different plan, but that plan may not be available in the area in which you live. And of course, eligibility is not affected by health conditions, so we do not ask any health questions. And we will not, of course, ask any financial information as far as your financial status. So the premiums can change from year to year. Usually the plan premiums for a Medicare Advantage plan are $0 or perhaps $20 a month, very low. Your Medicare supplement plans will run close to $100 a month for a monthly premium, and they will go up each year that you get older. And there are different rates for males and females. So we run into a lot of individuals that are in their 70s or 80s, and they're spending $250, $300, even up to $400 a month for a Medicare supplement plan. And plus to that, they have to add their Part D plan for prescription drug coverage. And compare that to Medicare Advantage plan, which has a $0 monthly premium and includes all the coverages together. But a lot of people do like it that it is one single plan. And some of the plans perhaps will not have prescription drug coverage. That would be the plans that we would offer to our veterans that have veterans VA coverage, and they have automatic prescription drug coverage included. So we can provide a Medicare Advantage plan that will give them the dental, the vision, the hearing, and it will not affect in any way their veterans coverage, and it's additional coverage to them. And usually those plans do not have a monthly premium. We do have different types of Medicare plans as far as an HMO, PPO. We have special needs plans that are available for people that are on Medicare and Medicaid. We have health maintenance organizations, HMO, POS plans, which means you're covered for in network, but if you go out of network or out of town, you'll still be covered as long as that doctor will take the Medicare or take assignment for Medicare as well. We do have medical savings accounts, private fee for services, don't have a whole lot of private fee for services in this local area at this time. So when can I enroll? Is our next question. Your annual enrollment period, which we're coming up on October the 15th, it starts October the 15th and goes until December the 7th. At that time, you can enroll in any plan that's available in your service area. You can then switch plans at that time as well, and all the changes that you make October the 15th to the December the 7th will be effective on January the 1st of the following year. Your initial enrollment period is called an IEP. Will begin 3 months before you turn the age of 65, then the month that you turn 65, and then 3 months after the age 65, by which you would be eligible to enroll in a Part D or a Medicare Advantage plan. If you do wait outside of that period and do not enroll, then you would have to wait until the annual enrollment period, the AEP, October the 15th, in order to enroll into a plan at that time. And you'll also will have special enrollment periods all during the year if you move out of your service area, or you have other special elections that you can select so that you can take a coverage to begin in February or March. Especially this SEP will work for those people that continue to work after the age of 65 and say at the age of 70 decide to finally retire, and then they can elect the Part B coverage and then get a special enrollment period in the middle of the year to start the coverage. And then they'll get another election at the end of the year called an annual enrollment period, in which they can make a change if they so need to at that particular time. So what are my next steps? We'll take a look at your enrollment periods, research some of your options, ask some questions. There is financial help available through Medicare. It's called Medicare Extra Help, and that's based on your income. You can enroll into any plan that that's best for you. We do suggest a yearly review because your prescriptions will change during the year. Your plans will change their coverages and change their formulary. One of the other things we can help you with, of course, is to help you enroll in your Part B coverage. So a lot of times your Part A is automatically given to you for your age 65. You do have to elect the Part B coverage and make an application. So a lot of people stop by our office 3 months in advance of turn 65. We help them complete the application that is sent into Social Security, and then they will be receiving their red, white, and blue card shortly after that application is submitted to start their Part B coverage. Additional resources will be through visitmedicare.gov. Is a great website where you can get additional information. You can call 1-800-MEDICARE 24 hours a day, 7 days a week. You can visit the ShipACenter.org website or visit the State Health Insurance Assistance Program, which is the SHIP program. Currently, they work out of the Shipyard Boulevard Senior Citizen Center on Shipyard, where you can go by and get an appointment and discuss your options with an individual at that time. So with that in mind, I would like to thank you for attending, and let me know if you do have any questions. We do provide, once again, help to help people enroll in their Part B coverage. And as I like to end this with, welcome to Medicare. It's a whole new ballgame.